histamine receptor antagonist or blocker. The sedative antihistamines are including chlorpheniramine, phenyramine, cyclazine, diphenhydramine, dimenhydrinate, promethazine. And non-sedating antihistamine are loratadine, fexofenadine, deslorotadine. इसके अलावा भी बहुत सारे हैं, लेकिन these are the few examples. When these antihistamine blocks, especially when sedative and non-sedative block this H1 receptor, it blocking in competitive way. These drugs compete with histamine. These drugs compete with histamine to prevent histamine from binding here. And these drugs occupy this extracellular domain at a specific point. So when these drugs block this receptor, so there is no intracellular signaling, no calcium influx. When there is no calcium influx, there is no contraction, and there is no bronchoconstriction, and bronchoconstriction will relieved. So mean ke these drug relieving cough and they acting as a antitussive. For example, the best antitussive antihistamine is diphenhydramine, which is available in Pakistan by Hydralene. So they also convert the diarrhea into constipation. Now, due to this blockage, the release of neurotransmitter is interrupted. So this pathway is blocked. When this pathway is blocked, MS is stopped. Especially dimenhydrinate, which is available under the trade name gravinate. Remember, dimenhydrinate is the combination of diphenhydramine plus 8-chlorotheophylline, 53% diphenhydramine and 55% 8-chlorotheophylline. This combination is known as dimenhydrinate. Remember that dimenhydrinate is not a single medicinal agent. It is the combination of two, and it acting as best anti-MSs. Similarly, when these neurotransmitters are interrupted, there is sedation, especially due to promethazine. There is increased appetite due to cyproheptadine H1 receptor blocker. And there is restlessness, becheni. Again, that restlessness is due to these neurotransmitter interruption. Again, this protein kinase is not stimulating, no special protein. When no special protein formation occur, the body secretion will decrease. Especially there is dry mouth and urinary retention. When there is no abnormal protein synthesis, allergic reaction is stopped, means there is no itching, no urticaria, pain will relieve, inflammation will relieve. Remember that these antihistamines, these are sedative and they are not sedative. One possible mechanism is the problem is binding site. Let's suppose the sedative bind at point 1, 2. If the blocker bind at point number 1 or 2, there will be sedation. And if they bind at point 3 and 4, there will be no sedation. Why the same receptor producing sometimes sedation and the same receptor not producing same sedation sometime? बाज़ टाइम ये रिसेप्टर सेडेटिव रोल अदा करता है, बाज़ टाइम ये रिसेप्टर देयर इज़ नो सेडेशन. The main proposed mechanism, according to my opinion, is just the point up attachment. Just like in electricity board, there are button 1, 2, 3, 4. अगर आप बटन 1 दबाएं तो there is switch on of the bulb. अगर आप button number 2 दबाएं तो there is switch on of the fan. Just like here, अगर आप if the blocker bind here at point 1, 2, there will be sedation. If these bind at point number 3, 4, there will be no sedation. Remember, this is the proposed mechanism, not exact mechanism. Remember, these antihistamine also bind with other receptor, also blocking other receptor in addition to H1 receptor. For example, they also block serotonin receptor, and due to this blockage, it produce increasing appetite, especially cyproheptadine, and we are using such antihistamine in case of anorexia, भूख न लगना. So we increasing appetite by these antihistamine, and in the market this is available with the formula of cyproheptadine, and this is known as secondary use. This is secondary use. Alpha 1 receptor blocker, they are also blocking alpha 1 receptor. When they block alpha 1 receptor partially, there is increased hypotension, there is increased dizziness, and there is reflex tachycardia. When they also block muscarinic receptor. When they block muscarinic receptor, there is dry mouth, there is urinary retention, and there is increased sinus tachycardia. This urinary retention we can use this drug as to reduce the urine frequency or dropping urine. If there is problem to a patient dropping urine, we can use these antihistamine as secondary use to reduce their dropping urine in the form of urinary retention. Thank you for listening.